What are your thoughts? And maybe I'm going down the wrong road right now, but being an insurance actuary, you probably you realize this because you're a numbers person. But what are your thoughts about our healthcare system, and when people don't have skin in the game, and it costs them nothing, that they have no responsibility for their own health? How
Mhm.
does that look overall with our healthcare expenditures? Are we missing something, or is that more important than some magic drug or magic procedure that's going to fix everybody's health problems?
Yeah, I think you're hitting exactly on something I've been spending a lot of time and putting a lot of effort into, and I term it as mindset. I talk about what are the ways we think about healthcare. Some of it is just so common and so much a part of us as Americans that we don't stop and think about the fact that the way we tend to think about healthcare, the way society tends to think about healthcare, that it should just be provided to everybody, that it should be regardless of ability to pay or willingness to pay. It should just be something we should take care of each other and take care of everybody. And on the one hand, that sounds nice, but on the other hand, we don't do any other even necessary and vitally important goods and services. We don't ensure that people have enough to eat by putting everybody in the whole country or trying to put everybody in the whole country on one system of food
Right.
distribution and requiring everybody to be part of some vast administrative system, if you will. And I kind of put the word system in air quotes because that's, a talking point for me or an item for me is that, is it really a system and should we think about it as a system? But just taking the example of, we don't ensure that the low income folks or the people that have hit hard times in their life, that they have enough to eat by putting everybody in the whole country under a system of food distribution. We do what makes sense. We do what works. And we've kind of forgotten that we should at least think about whether those same principles that work for distributing other important goods and services, whether that would work in healthcare. So we kind of have this mindset in this country that healthcare is different than everything else. The usual rules, the usual economic principles, the usual actuarial principles don't apply because it's somehow special or different. And I'm trying to get in the work that I'm doing on primary care mindset, I'm trying to bring some of those assumptions that we don't often think about. I'm trying to bring them to the forefront and challenge ourselves, challenge each other to really think about how we look at paying for medical care. Because it's really the mindset of somebody else is going to take care of me. I should be taken care of no matter what kind of decisions I make in my life. But again, we don't do that sort of thinking with any other good and service, food or transportation or shelter or anything else that we need. So I think, maybe as an actuary or maybe just as, somebody that's really looking for the right solutions, the things that will work, I always am trying to look at what really works. And I think we tend to not really ask that question with healthcare because we're so busy talking about, kind of the latest terminology, or we're busy worrying about, social determinants of health, or, some of these other things which do have some meaning and do have some value, but are a little bit more like buzzwords sometimes. And the whole apparatus of healthcare and healthcare research, healthcare reform, people that work in healthcare is sometimes very narrowly focused. And I'm trying to broaden how we think about it and make sure we're thinking about healthcare the way we think about other things.